You'll be able to form a Christmas bubble with up to 2 other households. You'll be able to spend time together at home or go for a walk, go to church or another communal service for worship. Reflecting the ties of kinship across our islands, this agreement means that wherever you live in the UK, families will be able to reunite.
A problem. You'd expect that the effect of the Thanksgiving surge would be probably another week and a week and a half from now, because it's usually 2.5 weeks from the time of the event. The problem is that's going to come right up to the beginning of the Christmas Hanukkah potential surge. So you have a surge upon a surge, and then before you can handle that, more people are going to travel over Christmas, and we don't mitigate well. We don't listen to the public health measures that we need to follow, that we could start to see things really get bad in the middle of January. Without substantial mitigation, the middle of January can be a really dark time for us.
Dr. Bharat Pankhania joins us now as a senior clinical lecturer at the University of Exeter's Medical School. Dr. Pankhania, as always, thank you so much for taking time to talk to us. Every doctor and scientist I've heard who has said, fine, let's allow some sort of gatherings over Christmas, has couched that advice in terms of mental health and not physical health. What's your opinion about getting together over Christmas and New Year?
It's a high-risk activity, in short. When people interact, a series of events happen. You leave your origin at one place, you go all the way to another place, you meet up, and what you are creating is lots and lots of connections with people that you are not normally connected with. And when this is amplified tens and thousands of times, you create a rise in number of cases. This is basic science. And therefore, what will happen, as Dr. Fauci from the United States was saying, we will get a rise in number of cases. And what he is saying also, and I will mirror that, is it is also the seasonal influenza season. And therefore, we expect a rise in number of cases and a rise in number of hospital admissions too. I would say it is better to have a low-key Christmas. You can meet up over the telephone, internet, and postpone meeting up and look forward to a better 2021.
A former chief scientific advisor to the UK government, Sir David King, has said that Christmas could well turn out to be a super spreader event, and that could apply to anywhere in the world, exactly. So why are some governments relaxing their rules at this time?
I think they're pandering to popular pressures and not having what I would call in medical terms a good backbone, a good vertebral column. So if we look at the example set by Angela Merkel in Germany, she has clearly identified an issue and said so upfront, that we do not want gatherings over Christmas because people can get infected. And the other thing to look forward to in 2021 is the immunizations. The vaccines are almost around the corner. So why not just postpone this gathering in 2020 for a much better 2021?
You mentioned the vaccines. So programs have begun to be rolled out in a few countries. What is the medical advice for people who have had vaccinations or who are meeting people who have had the injections?
Well, the vaccines protect you from severe illness. That is what the experiments, the trials of Pfizer, BioNTech showed. So what you do is, whilst you are immunized, you look at this as an additional layer of protection that you have acquired. But that doesn't mean you discard your other layers of protection at the same time. You mustn't. Therefore, you continue with wearing your mask properly. You continue with avoiding crowded places, avoiding crowds and closed indoor places. And of course, washing your hands. So you continue with all the other layers of protection that you were, and now be happy and be confident that you've been given an additional very good layer of protection. And in time, when everyone has got that additional new layer of protection, we can start thinking about relaxing on the mask wearing and crowds and indoor places, but not just yet.
Dr. Bharat Pankhania, if you and I don't speak before Christmas and New Year, let me extend, please, my season's greetings to you. Thank you so much indeed, as always.
And same to you. Thank you very much.
Thank you.